Sitting, hospital outpatient clinic. You see the parent of a 7-year-old girl who has come to have a throat swab taken. You are providing some information. The girl is sitting nearby. Now, let's see the task. First one says, explore the reason for the parent's visit. Find out if the child has had a throat swab before. Second one says, explain the process of a throat swab. Sample of throat tissue taken with a cotton wool, but quick process, slight discomfort, minor risk of gagging, etc. Third one says, suggest the parent stays with the child during the procedure. Fourth one says, describe analysis of throat swab. Culture grown in lab. Chemical tests show type of infection. Then find out if the child uses mouthwashes. Fifth one says, outline the effect of mouthwash on the throat swab. It kills bacteria. Test results compromised. Sixth one says, resist giving a prognosis. Not your role. Throat swab needed for diagnosis. Appropriate treatment decided by GP, etc. The seventh one says, give details about the result. 2 days. Follow-up appointment with doctor. The last one says, establish the parent consent for the child's throat swab. Now, let's begin the role play. Hello, good morning. I'm John, one of the registered nurses in this hospital outpatient clinic. What brings you here today?
Hi, good morning, nurse. My daughter needs to have a throat swab, so I'm here to know more about it.
Okay, do not worry. I'm here to help you. Before moving further, how may I address you?
You can call me Sarah.
Hi, Sarah. Could you please elaborate me your concerns in detail?
Sure, nurse. Today I'm here with my daughter who has been having frequent sore throat. Therefore, the doctor suggested to do a throat swab. However, I'm not really aware about the procedure. So could you please explain to me more about the procedure?
Sure, Sarah. It's my pleasure and responsibility to assist you. Let me explain that in detail. A throat swab culture or throat culture is a test commonly used to diagnose bacterial infections in the throat, and it is a minor test which is done in laboratory. During the test, a sample from the back of your throat near your tonsils is collected with a cotton wool. This test is usually done when a throat infection is suspected. A throat culture can also help your doctor to determine which antibiotic will work best for you. Okay, Sarah, may I know if your daughter has done a throat swab before?
Nurse, my daughter is just 7-year-old and she has never done this test before.
Being a mother, I can totally understand your worries, Sarah. But there is nothing to be alarmed about the test. However, her throat may be sore when this test is done. Moreover, she may feel like gagging when the back of the throat is touched with a swab. That is, after the test, she may feel some sort of discomfort or minor gagging. Therefore, it is recommended to stay with her throughout the procedure to make her more comfortable. I hope you're following me.
I understand that. However, I don't think just taking a little bit of throat swab can show what is wrong with my daughter.
Your concern is reasonable, but don't be overly concerned about it. I can explain you the procedure in detail so that you will get a better understanding about the procedure. The throat swab which is taken can be analyzed in specialized setting in the lab. That is, the sample swabbed from the back of the throat is put on a special plate, that is culture, that enables bacteria to grow in the lab. If bacteria don't grow, the culture is negative and the person does not have throat infection. This test helps the doctors to identify the bacteria as well as the infection present. Moreover, throat culture can also help the doctor to determine which antibiotic will work best for your daughter's condition, as I mentioned it before. I hope it's clear for you.
Yes, nurse. I understand the procedure.
Glad to know that. By the way, I would like to know if your child uses any mouthwash.
No, my daughter does not use any mouthwash. May I know Why you need to know about this?
Sarah, it is not advisable to use mouthwash before the test because a mouthwash is an agent that can kill the bacteria and it may compromise the throat swab result. So, it is not really recommended to use the mouthwash before the test. I hope you're with me.
Okay, nurse, I understand that. However, what will happen if the throat swab shows that my daughter has something serious?
Okay, Sarah, I acknowledge your feeling. Please set your mind at ease. A normal or negative result means that there are no bacteria or other germs that may cause a sore throat. When the result is normal or positive, it means bacteria or other germs that can cause a sore throat were found on the throat swab. However, the test can provide a great insight to the doctor and can provide the best treatment accordingly. I hope you're with me.
Okay, nurse.
Moreover, I'm not authorized to confirm about the result and its impact. As I said, a throat swab is just a test to identify the cause, and thereafter, the GP will provide your daughter with the most appropriate treatment, and try not to worry.
Could you please let me know when the test result will be available?
It usually takes around 2 days to get the result. As soon as you receive the result, you can schedule your doctor's follow-up appointment with the general practitioner. Is it okay with you?
Certainly, nurse. Thank you.
Can I have your consent to take the throat swab sample?
Please proceed, nurse.
Thank you, Sarah. I would like to go over again. Until now, we have been discussing the throat swab test and its importance. I hope you understand that. Now you please relax here. I'm going to take its sample now. Meanwhile, if you have any questions, you can ask me. I would be glad to help you. Thank you, Sarah, for your visit to our facility. I wish your daughter a faster recovery.
Thank you, nurse. Thank you so much for your support.
Thank you all. Our role play ends here.